And then once people start on the Sinclair method, just starting can bring an entirely different subset of challenges. So why don't you talk about a few of those?
Yeah, so for example, let's say that a person has the prescription, they have not been misinformed, so they're going to take the naltrexone. Now, the standard instructions would be so the concern here would be side effects or some other unpleasant experience. So the kind of way to combat that would be for the first 2 days, take a half a tablet, which would be 25 milligrams. And I'm very kind of repetitive and about taking it with a meal, not just food, not just, had a little, but really take it with a full meal and half a tablet for a minimum of 2 days. Now, some people have, let's say they have irritable bowel syndrome, or of course, alcohol itself is a gastric irritant, or they just know that they're sensitive, or they're just anxious. They don't know what this med's going to do. And so then I will advise take a quarter of a pill, or take an eighth of a pill if you have a small enough pill cutter, that no matter what, whatever you feel comfortable, whatever dosing increment it takes to initiate, to get over that tiny barrier, which is reasonable. It's kind of to be expected to take this substance you've never tried. So I really just try to emphasize that this is a long-term process. You're going to, taking an extra day or two or a week or two or whatever it is to make you feel comfortable. Take the smallest dose and just inch your way up with a full meal. So that's usually just the first barrier. What is this going to do? What side effects is it going to cause? Of course, a lot of people are concerned about liver problems. There used to be, and I think this was 2013 or 14, there used to be a black box warning on the naltrexone package insert. So of course that is scary. That's frightening. So a lot of people see that. So they want people kind of want to talk about the possibility of liver damage. So now I consider that to be sort of really unfortunate that something so toxic for the liver as alcohol, that the treatment for that, there would be a black box warning about liver damage. It's a really painful irony for people, because we know that at normal doses that we use, there's no evidence of liver toxicity, and even in the studies that were the basis for that original black box warning, they were all reversible, transient. There was nothing significant for that basis to scare people. But depending on what sources people are reading, it might still have that black box warning on there. So that's a big fear. What's going to happen? What is this drug going to do to me?
And if I recall, the actual toxicity level is something along the lines of 300 milligrams every single day for an extended period of time or something like that. Is that correct?
That's right. It was 300 milligrams. And beyond that, it was just a very small study. It was 26 participants. And of course, and there were some comorbidities involved as well. But what's interesting is, there are many kind of just head-scratching elements to it. But again, it was all reversible. Once these elevations, these enzyme elevations were detected in these very high doses, which 300 milligrams would be 6 times the usual dose. Once those elevations were detected, they were completely reversible. In other words, there really essentially nothing happened as a result of taking a very, very, very high dose of naltrexone. Meanwhile, is there anything more toxic than alcohol for the liver? There may be, but not in a grocery store probably, or not even in a pharmacy. They sell alcohol now. So, so just when you're comparing the two, it's really not even close. So that is often a barrier. I would say the liver. Generally, just people have an abstract concern about side effects, but then, kind of more specifically, the liver is the main one that people have heard about. But and kind of along those lines with barriers, at Sinclair Method, we really, unless there's a very, very specific active liver damage, we really start people without liver monitoring, because we know that the alcohol is really the concern here, not the naltrexone. Now, of course, once we're started, we can do subsequent follow-up, but we really try to, if the person is there for an appointment that day, after all, the guilt and stigma and all these things, we want to get them that naltrexone as quickly as possible, and we'll do the follow-up later. So we try to lower that barrier as well. So really just getting people started while the motivation is there.